Hello everyone, welcome to Dentospedia, which is the most trusted platform for any dental board exam. So today I'm going to teach you a short topic on bacterial infections of the oral cavity. So let's begin with the topic. Now next is Mycobacterium tuberculosis. Understood? So see, tuberculosis is a chronic infectious disease caused by Mycobacterium tuberculosis. Now it mainly affects the lung, but it can also involve oral tissue. It affects the lungs, but it can also involve oral tissue, especially in patients with active or secondary TB. Understood? Now oral lesions are rare but can occur in secondary TB. Understood? There will be a chronic non-healing ulcer with indurated borders. Please remember this, indurated borders. Understood? Seen on the tongue. Now accompanied by cervical lymphadenopathy, weight loss and night sweats. Understood? So oral TB lesions are rare. They usually occurs in secondary TB due to spread from infected sputum. Now there will be reduced immunity. Understand? There will be reduced immunity and local trauma to the oral mucosa. Understand? There will be local trauma to the oral mucosa. So what are the clinical features? So what are the characteristics of ulcer? So it will be chronic and non-healing ulcer. There will be a irregular shape and the margins will be indurated. Now the base may be granular or covered with a necrotic tissue. Now the common sites are tongue, also lips, gingiva or palate, but tongue is more common. Understood? So please remember all these things. There will be an irregular shape. Understand? Non-healing ulcer with indurated margins. Understood? Please remember all this. Now the base may be granular or covered with a necrotic mass. Covered with a necrotic mass. Understand? Common site are tongue most commonly, but it can also be seen on lips, gingiva or palate. You can see oral tuberculosis ulcer mostly seen on the tongue, and you can also see cervical lymphadenopathy. Now this will be an irregular non-healing ulcer. Understood? Now cervical lymphadenopathy, there will be enlarged neck lymph node. Understand? There will be enlarged neck lymph node. Now there will be a painful ulcer. Unlike syphilis, in syphilis the ulcer was not painful, but in tuberculosis the ulcer will be painful. Now there will be systemic symptoms as well, like weight loss, night sweats, fever or fatigue. Understood? So see, a persistent non-healing oral ulcer associated with cervical lymphadenopathy should always raise suspicion of tuberculosis. Now, this is especially important when the ulcer does not respond to routine treatment and the patient has constitutional symptoms. Understood? So, differential diagnosis. What do you think the differential diagnosis will be? So, it can be squamous cell carcinoma, traumatic ulcer or syphilitic ulcer. Understood? Hence, investigation is very mandatory. Now, you can see the diagnosis. So, it is confirmed by chest x-ray, Montauk's test, which is very, very important. Understood? Montauk's test. Then biopsy of the ulcer showing granulomatous inflammation. Understand? Granulomatous inflammation or acid-fast bacilli or Ziehl-Neelsen stain. Understand? Acid-fast bacilli, which is AFB. Understand? On Zn stain. On Zn stain, which is a Ziehl-Neelsen stain. Understood? Please remember all these terms. Understood? AFB, which is acid-fast bacilli on Ziehl-Neelsen stain. Now see, the treatment. Treatment will be RIPE therapy. Understand? Anti-tubercular drugs. So it involves rifampin, isoniazid, pyrazinamide and ethambutol. So these are the treatment of drugs. Understand? So dental treatment should be deferred until the TB is controlled. So that's all for bacterial infections of the oral cavity. For more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.